Hi, good morning. I'm gonna perform an auto scenario. So I just received a call that there in the ER that there's somebody gonna be hooked up with an oxygen. So I will immediately go to the emergency room, and then I observed the patient to be lethargic, and then the doctor insisted to be hooked up with a simple mask. So I immediately put this one to the patient, simple mask. So of course before that, I always make sure that I'm able to obtain any pertinent information, and then at the same time, of course, I have to do a set of vital signs and patient assessment to the patient. So before that, I have here a simple mask, and then it was being ordered because the doctor insisted to be hooked up with a simple mask. So I just immediately put this one up with a simple mask to the patient. So with a simple mask, make sure you feel it with your fingers or your hand if there is adequate oxygen or air coming out. So once you feel it, make sure that the tubings no longer kink, and then hook it up to the patient. So after that, you always make sure you give a few minutes to observe the patient if they were doing well. And then once you already do those and you already assess the patient, so you can document and chart it with a patient's chart. So in a while, I just realized, and then when I check it the patient's chart after a few minutes, that the patient was just recently diagnosed with COPD or emphysema. So I immediately coordinated with a nurse, and at the same time, good thing the physician was there, that because the patient was being hooked up with simple mask, I think it is contraindicated for that, especially with the flow of 4 liters, because it acts as the patient would breathe more CO2 instead of oxygen. So with that, I recommended to the physician that I will be hooking this one up with the non-rebreather mask. So with the non-rebreather mask, the patient would not rebreathe any CO2. So with this, I always make sure that I have the non-rebreather in place in here, just to let the patient not rebreathe any CO2 because the patient was recently diagnosed COPD. So for that, I have to turn this one off, and then hook it up with a non-rebreather mask, and then set it with the appropriate flow. And then once you set it up, make sure that the valves are present, not missing, and then observe the bag to be fully inflated. Make sure that it's inflated before you put it in the patient. And then with a simple mask, you can just put it in a clean plastic container, just in case if the patient needs this in the long run. So once you feel, or assuming if this bag is already inflated, make sure that the connectors are no longer kink, and then you observe that the bag is inflated, and then of course we always put this to the patient. In that way, because the patient is COPD, he or she will not retain any carbon dioxide. So after that, make sure that the bag is not deflated, especially if the patient breathes in. And then once you sense it to be the patient that's doing well, so of course we always do our assessment, post-assessment, and then chart it every time we do it, document everything, and then of course we can coordinate with the nurse station or if the physician which was present, so that we can communicate with them at all times. And then